Hey, we're just coming off our first queer scar care drop-in session, first of many.
We had a couple of folks drop in, all of whom were nearing their surgery dates or just post-surgery dates. So it was a small range as far as scars go, and also there was a lot of breadth of questions within that tiny little range, which was great. We had so many questions we got to in just an hour.
Yeah.
I think one of my favorites was uh, how soon is it safe to touch the scars and how to touch them.
hmm Yeah, we talked about kind of leaning into as much touch as is safe to use as consistently as possible. So really wanting to get used to touching the area, really feeling like connected to that part of your body. So we talked about like breath even as a first point. So coming out of surgery and that breath is going to be accessible and is a way you can, stretch from the inside and feel connected to the body. And then from there, touching the area around the scars. So, not on the incisions directly, but as close as you can get before things start to feel tender, and just kind of getting used to that feeling. And then over time, working in closer as it feels, as the pain and swelling is down enough that that feels comfortable. And then from there, once the wounds are healed, starting to touch directly. But with a lot of gentleness, like more gentleness maybe than you think you need. So Ro had talked about starting with like petting a mouse. And then, if that feels fine afterwards and the next day you don't have any increased pain or puffiness or anything, then maybe like petting a chinchilla. And then maybe a hamster and then maybe a kitten. So just slowly progressing and checking in with your body during and after and seeing if that seems to be landing well, just increasing gradually. And if you do have a day that you wake up and you're feeling tender afterwards, or you're noticing some swelling, then just knowing that that's a good sign to back down, go back to hamster from kitten, and stay there for a bit until you want to try again.
I love that.
Yeah.
Yeah, we had a range of questions from the clinical pieces, and then we also had a lot of questions from the kind of heart and spirit places as well.
Yeah, there was one about anticipating grief and coming into a body change with both agency and some ambivalence, and how to navigate the processing of that.
hmm This is some of my favorite stuff, that gooiness of change. And one thing I like to do is make sure that I remember and have things in place to center on why I'm making a choice, and honoring that many things have led me to this and the scales have tipped enough, and this is where I'm going, and knowing what I'm moving towards, just as much as I take the time to have practices prepared to sit with and be with the gooey complexity of, I've got grief around this choice, and I feel politically like I'm on a seesaw around this choice, and I'm also really fucking excited about this choice, and I'm also scared about this choice, and I also can't wait to get past the healing process. And we're often holding, this huge bundle of things, and um, there's a lot of tools that we got to go over, and so many more to support those processes. One of my favorite ones is just the witnessing, and you get to talk about this sometimes when you're speaking to the lymphatic drainage rituals that you do before and after surgeries. It's that having a space in which we can really just bear our full journey with somebody and be held in that and have it honored and witnessed and not questioned. Um, yeah, so much of the grief and pleasure circles that I do for top surgeries are about the witnessing and the complexity of, especially having folks who maybe they just had surgery a couple weeks ago, and folks who had surgery maybe 10 years ago, and having that range and getting to see from each other the processes and, how nonlinear they are for everybody in very different, unique ways. So,
So thanks so much to the folks that joined us. We hope to see more of you next time, and also welcome folks that are, far out from having had surgeries in the past. The space is for you also, and we're excited for all the questions to come.
mhm. Yeah, and just a reminder, they don't need to be gender-related surgeries.
Yeah.
Any surgeries, you know. Um, if you identify somewhere along the queer spectrum of sorts, then please join us. Nope.
Also non-surgical trauma scars, self-injury scars, whatever the origin of your scars, if you are a queer person and want to be in the space to talk about them, that's what we're here for.
Mm-hmm. Yeah, very that. And you can also send us your questions in advance, and then we'll have some time to prepare specifically. Right now, what we're doing is whatever shows up in the room. So
Mm.
if you show up, then that's what we're going to talk about is what you're bringing. So you're also welcome to come and just, you know, bear witness. That would be fine too. So we don't expect these to be very large. They'll probably continue to stay small, and that's the point. So everybody can get really individualized attention. And because they're drop-in, what we saw tonight was people come and people leave, and that was perfect. It was like waves of questions.